Well, it was very informative, our first meeting. I've been contemplating on how we can gain the information that you have in this meeting. I was thinking that, looking at Western medicine, it's kind of, they take these systems and they break them down to the smallest possible component. You take one system, you take it down to the cellular level, and then you try to treat the cellular functioning to bring everything back up. And yet, looking at some of the more ancient healing traditions, you tend to find that there is an energetic in terms of looking at the whole person and looking at different components. And it's apparent in Ayurvedic that while the systems themselves are important in their work, I'm interested in hearing what those components are that make up the holism of a person. And I would assume that it's the pattern that that person presents to you that you look at in terms of, is there something that's imbalanced, which Western medicine tends to leave out. They don't seem to, it has to escalate to the disease proportion in order to be treated, where in your practice, I assume you see people and are saying, I sense something's wrong now and we need to deal with it before we get to that disease state if we can. So perhaps you can enlighten us on the elements that are involved in how you assess someone to figure out what is going on in their health and what you can do to benefit them. Does that make sense?
Yes, it does. A lot of sense. And I'm glad you picked up on it. There are 2-3 different aspects to your question. I'll try and answer each of them separately. You first started with looking at how the difference between modern medicine and Ayurveda, about how there is this tendency of going towards the smallest unit and then understand that smallest unit. This is also true when it comes to the treatment part. When I say that, it is people will focus on the molecule. People will focus on the active principle, even if it's a herbal remedy that is suggested. For example, if I'm suggesting Glyceria glabra, a herb, a very, very commonly used herb, glycerin is one of the active ingredients, but that is not the only component that is working. But from the modern biochemistry or the modern pharmaceutical approach to it, would we try and isolate glycerin and see if that works in a particular condition? And many a times it is found that it is not the case. So if you give the whole drug, it works. But if you isolate the active component and give it, it does not work.
It seems that that's pretty common in dealing with plants, that they have multiple molecules. And I would assume also that you might put more than one herb together.
Yes. So at times, the other molecules which are present, they are also equally important, if not more, than the active ingredient. It's a bit like in a movie, if you suddenly decide to eliminate all other cast and only keep the lead actor, the movie is not going to happen. However small the part may be, every actor has a role to play, even if it's a 2-minute role, but it may be the most significant 2-minute role that is played by an actor.
Yes, the supporting roles. I talk about that with Chinese herbs, that it's like having a recipe. If you're baking a cake and you leave out an ingredient, you don't get what you want. So it's very important. It's not, when you're prescribing, it sounds like, and we don't want to probably get into the prescription necessarily, but it certainly sounds like you take into account all those supporting factors that go with each of them that you prescribe.
Yes. So this is the first thing that, it's very similar in the approach where the diagnosis is also of the smallest possible unit. The remedy is also the smallest possible unit and try and fit it all together. But then in doing so, we may have eliminated a lot of other important aspects which have a role to play. So that brings me to the next part of your question about what is it that, or how is it possible to kind of preempt a disease or a condition? How is it that you know that something is wrong? Before I answer that, again, I'll bring to your notice that Ayurveda itself has very clearly laid down the aim, which is prevention of disease, but that is at the second position. The first aim of Ayurveda, as specified in the text of Ayurveda, as accepted by the treatises of Ayurveda, is to maintain the health of the healthy. So that is the first aim. That is the first goal that Ayurveda has. And then, if for whatever reason a person does tend to become unwell, so that could be because of environmental factors, it could be because of dietary factors, it could be other infections or whatever it is, wrong choices that a person makes. All of these will lead to disease, and then the disease identification, diagnosis, differential diagnosis, and then the treatment part of it comes at a second stage, that comes at a latter stage. So right at the beginning, it's very, very clear that we are here to help the healthy to remain healthy, continue to remain healthy. And then in case somebody has a problem, then we can intervene and restore the health. So that is the approach that every Ayurveda physician should have. Unfortunately, what is happening, of course, things are changing post-COVID particularly. There is a lot of emphasis on wellness. There's a lot of emphasis on maintenance of health. So that's where people are suddenly realizing that, hang on, Ayurveda is a viable alternative that we can look at.
Well, it's interesting because obviously looking at someone to do preventive health, I assume that that's not one size fits everyone. It has to be individualized for each person based on all the things that fit them.
Yes, absolutely. Absolutely. So what may work for one person may not work for somebody else, because, for example, what may work for you where you are and what may work for me for a similar condition may be completely different. And that's to do with not only us as individuals, the differences that we have, but also the environmental factors, the dietary factors, what is available around you, and everything else, the kind of lifestyle that a person has. So there are a lot of permutations and combinations. Having said that, at times when this is put forth, it leads to more confusion, it leads to more questions than answers. Because then people kind of become apprehensive and say, oh, which means it's very, very difficult. It's not something that can be easily followed. It's not that. See, there are some basics which remain the same. Everybody goes to work in the morning, returns at evening wherever they are. Returns in the evening wherever they are. It could be in the US, it could be in the UK, it could be in India. That the basic idea remains the same. But how it is actually put in practice. So how a person goes to work here in India, a person may not wear a business suit because of the temperatures. Whereas somewhere in the US, the person may go to work at the same time, may leave house at 9 in the morning, but with a completely different attire. So, the basics remain the same, but it's just how they are implemented. Those are tweaked based on each person. So, otherwise that becomes a major question which means there is nothing which is fixed. It's not like that. Everything is fixed. There is a basic framework which is available. Only thing is you have to then mold it according to your conditions. You have to mold it to best suit you.
Okay. And are there specific categories or patterns that people tend to fall into? I assume that even though it's very individualized and there are probably different levels, but there are, from my minimal understanding, is this the pattern of what would be considered a dosha for a person, that they have a
Yes.
specific. Can you describe what that means? I think most Americans just think they eat a specific diet and that's enough to take care of it.
No. What it means is there are these three basic humors that control most bodily functions. And they're present in every individual because without them, the individual will not be able to function. There are three energies, if I may call them that.
Yes.
Where there is the energy of movement, there's the energy of metabolism, conversion, and then the energy that binds everything together, holds everything together.
Okay.
So now if you think of it, this is what is required in a cell. A cell has to have a particular structure. It has to have a particular shape and arrangements of all the cell organelles. That is the energy that binds everything together. Then in a cell, there'll be the organelle, the component that is the powerhouse of the cell, which produces the necessary energy to power the cell, to help the cell to function.
Mm-hmm.
And then when all these activities are happening, there is another energy which helps in transportation, getting the raw material in, helping in the process of metabolism, helping the process of metabolism to move ahead, and then eliminating what is not required, processing the different stimuli that the cell is exposed to, and getting the reaction of the cell to all the stimuli that the cell receives. So that's the energy of movement. So this is at a very, very basic cellular level. And then this similar arrangement is at the tissue level, at a system level, and then at an individual level. So these three basic energies are present in every individual. But based on which of these energies is dominant in the parents,
Mm-hmm.
which of these energies is dominant during the period of conception, which of these energies is dominant in the external environment when the person is conceived,
Mm-hmm.
based on what is the maternal diet, based on what, as during pregnancy, I mean, what is the kind of environment that the mother is exposed to during pregnancy. All these factors play a role in fine-tuning the levels of energy in that individual. So there will be some individuals with a very, very high metabolic rate. There will be some individuals where there is a lot of stasis. The energy of that binds everything together is very strong. The movements are very slow. And then there is another, the third energy where there is a predominance of movement. So a person will not be able to sit still. A person will be very fidgety. A person will even in his thought process, now he'll be thinking of one thing and the next moment he'll change his mind to something else. So all these factors contribute towards kind of forging the basic constitution of each individual, where there is a dominance of one particular type of energy, and these are the type of traits that the person will carry through his life. And when I say traits, I don't only mean behavioral traits, but this is to do right from his complexion to the type of skin, to the type of hair, to the type of preferences that the person has towards food, drink, towards people, to the type of environment that the person is in, and all of that. So that's the three basic constitutions. So then that allows us to have like a framework that all the people who are dominant of one type of energy, then you can say that, okay, this is a list of 10 things that will be beneficial. So a person who has very, very high metabolism, for example, usually prefers things which are calming, soothing, which are lower temperature. They prefer the mountains to the beach because it's cooler there. So you kind of have a framework. So 9 out of 10 people who belong to that particular constitution will be benefited following the regime which is suitable for that particular constitution.
But that allows you, but I assume that allows you, when you see them,
yes,
to be able to ask the appropriate questions that give you that information about where would you prefer, what would you like,
yes,
how do you feel. Okay.
Yeah. So if we put them through that questionnaire at the end of it, based on the response that they give, one is able to arrive. Of course, this, though the basic remains the same, it is like the basic temperament of a person. A person who is very hyper will, with age, also mellow down, will mature. But even then, there will be that little hyper streak in that person throughout. That basic tendency never goes away. Or with proper training, the person may be able to kind of balance out that impulsive behavior. But still, somewhere he still needs the training to be able to rein it in, right? So this basic nature does not change. Though over a period, over a lifetime, different experiences, different exposures bring a lot of change in the individual, but the base remains the same. So if you're able to identify that basic constitution of that person, then you have like a framework which is going to benefit. Once you have the framework, that framework can then be tailor-made to suit. So it's a bit like if you think of a double-breasted suit. The moment I mention a double-breasted suit, you know what exactly it looks like. But the size that fits me and the size that fits somebody else is different. That's the fine-tuning.
Yes. Now, does this mean that if you have a particular constitution, you tend to be more prone to certain types of illnesses also?
Yes. If you're not careful, if you don't understand your body, and if you indulge in activities or diet that will further aggravate, as I said, that it is about the dominant energy. So when a particular energy is dominant, you have to do everything to try and balance it out. But if you do things, so somebody who is, again, of this fiery constitution, consumes a lot of spices, consumes a lot of chilies, consumes a lot of foods which are very, very strong.
Mm-hmm.
Such a person is bound to develop conditions like uh, gastritis or gastroenteritis or gastritis or duodenal ulcers. So there is this predisposition which is augmented by the type of diet and lifestyle changes that a person makes. So if you're then able to educate the person and tell him that, look, this is what is beneficial for you. So it will be better if you have more uh, of bitters, or if you have more of astringent taste, if you have more of sweets, it is beneficial for you compared to the other tastes. So this is a benefit. This is like equipping the person to preempt and prevent possible diseases.
Okay. And is the same kind of, so I assume that if you have this disease, they've continued the inappropriate lifestyle long enough to create the disease, and now you have to try to back it down, and that probably takes a lot longer to do once they've gotten seriously ill.
Yes. And that's one of the reasons why there is, again, this major misconception that people carry, that Ayurveda takes a long time, that Ayurveda is slow compared to modern medicine. There are 2-3 reasons for that. One is what you exactly said, that the pathology has progressed so much that to try and undo it will require that much of time.
Yes.
The second, another important factor is to be able to undo the damage. There is a lot of effort that is required from the patient. It cannot be outsourced. You cannot say that I will continue to pop pills and I will eat what I want to.
Mm-hmm. Right.
Yeah.
Pretty good. Well, your comment initially, you said that somebody has a fiery disposition. I just keep thinking of all the inflammatory diseases that people probably develop in that kind of setting. Or if you have someone that has a very slow system, you start seeing thyroid problems or constipation, or so you can start connecting all these things. Do you think that people are willing to make those kind of changes when they see you? Is that something that people choose to come see you because even though they've had benefit, let's say, from taking a pill, do they recognize that that isn't an answer?
They do, but it takes time. That's what I'm saying. So for the person to realize this and then go and seek an Ayurveda practitioner takes time. See, because the usual tendency is when there is a problem, you first go to your GP, the GP prescribes some allopathy medication, you take it, you feel better. You feel that's it, it's sorted. But, unknowing to you, the pathology is still progressing, maybe at a slower pace for now. But then at a certain point in time, maybe 3 months down the line, it resurfaces. And this time it's much stronger.
Mm-hmm.
And then you again go to the GP, he prescribes the same medication. This time it doesn't work. Then you sort out a specialist or you seek out a specialist.
Yes.
And then the specialist puts you through some more tests and there's some more time that's gone by. The results come in and then the specialist may recommend some other medication, some other molecule which is stronger, which is newer. You try it for a while, but that's a hit and miss. It works at times, it doesn't work at times. By which time it's been more than a year and a half since the first episode. This is when you slowly realize that hang on, this does not seem to work. Let me think of what other ways I can help with. That's when you start researching. You'll go to Google, you'll go to your neighbors, you'll go to somebody else. And then if you're lucky, somebody may suggest that why don't you try Ayurveda? And then the person thinks of it, and then there's further apprehensions, questions, and all of that. So if those are overcome, finally the person is face to face with an Ayurveda physician.
Mm-hmm.
So you can imagine the baggage that's already built up. Okay,
Absolutely.
so to then have the person to make the necessary changes in the diet and lifestyle is a big challenge. So that's where the person, again, to repeat myself, the person has to be first made to understand that his or her health is their responsibility. It cannot be outsourced. You cannot expect the doctor to do the work for you. At best, it's the role that the Ayurveda physician can play is that of a coach. He cannot go and play the game for you.
Absolutely. So when you find that someone comes to you and they have a either preventive or as having an illness, I assume that perhaps there's a number of people that you have to start slowly with and kind of deal with one. It sounds like if you have a framework, then there are multiple aspects of the framework that have to be dealt with. But that must be one of the important aspects that you provide is being able to prioritize what needs to be done in the length of time and when to add things and how you go about that.
Yeah. See, what is needed is to first be able to, don't mind me, I'm moving to get a charger. So I'll keep talking to you. The first thing that needs to be done is to gain the trust of a person. Again, if I go back to that original story about how the person has run from pillar to post to try and seek help. So he's already mentally traumatized from the condition and from the fact that there is no help that's forthcoming easily.
Right.
So gaining that trust is the most important factor in this case, wherein if you can provide a solution that makes the person feel better and almost immediately, that really puts the person at ease, and that gives a lot of confidence to that person that yes, we are moving in the right direction. That's very important. So if you start from day one and start talking about diet and lifestyle and the changes that are required and all of that, the person may be further confused. So
Okay.
the first thing that normally the approach that I have kind of come to use is to try and help the person immediately as quickly as possible with the one or two most troublesome symptoms. So
And
with that,
again, you're saying that lifestyle and diet are going to be the long-term solution, but now you have to find something you can do that, so yeah, you're right. If somebody doesn't get results, they're not going to stay
yes,
and continue. And what do
yes,
you,
and especially somebody who's like in trouble. Remember, going back to that same story, that somebody who's having the same issue for almost a year and a half, 2 years, and has come to his wits end about how is it that he or she is going to address, and many a times even emotionally they become very, very low, and that becomes a major challenge.
and are there specific things that certain areas of treatment, obviously you prioritize those. There must be something you have that you can use for acute problems and things that you then step back and add something else.
Yes, yes. So there is, when it comes to the treatment aspect, there is the use of medications, the different herbs, combination of herbs, some minerals, which are, again, that's another another major topic about this whole thing about heavy metals and use of metals and minerals in treatment in Ayurveda and all of that. But if you think of it, even allopathy, even in the modern medicine, a lot of chemicals are used, but they may not be in their toxic form.
Right.
Because when the form changes, the characteristics change, the chemical nature changes. So one has to, sort of make peace with that. That it's not just lead or it's not just mercury. It can be a compound of lead or mercury, which is not as toxic, or which may be required in that particular case. Like we were talking about what needs to be done in the short term. To give some quick relief, we may have to use certain potent compounds which may or may not contain metals and minerals or animal origin products.
Sure.
So all of these, or pure herbs, or a combination of all of those. So that's one part of the treatment protocol. And second part is the use of different therapies. So you have purificatory measures. Panchakarma is something that a lot of people are familiar with. The detox and all the other treatment modalities. And they include things like bloodletting, they include things like enemas, then there is purging. So all of these. So there are, one is the treatment using medications, and then there's the treatment using the therapies, or it's a combination of both. So when applied initially, that helps in reducing the chief complaints that the person has. And then once that initial trust is gained, when that initial move is made towards getting better, that's where you start emphasizing more and more and more on diet and lifestyle, with a view that this does not recur, that you can then, make sure that you do not have to depend on medications throughout.
Now, when you see a patient and you are able to assess the type of pattern that they have, is there a hands-on aspect of how you evaluate people? Do you have to touch them and feel on their abdomen and take their pulse and do various things?
Yes, of course. So in a general sort of outpatient setting, a general practitioner of Ayurveda usually has about 6 different things that have to be considered. 6 basic things, like the pulse, then also asking about the elimination with regards to stools and urine, examination of the tongue, question about the sleep, and question about the metabolism. And that is gauged by asking about hunger, asking about appetite.
Okay.
So these are like the bare minimum. Then there are further examinations. So it could be of that particular part which has the problem. So if it's the skin with rashes or something else, or vesicles, or whatever is the presentation, or it could be percussion, auscultation, all of that.
So I assume that when you kind of have a picture or an image of the framework that someone has. And so I assume that you're able to direct your examination to the areas that will give you the information that either confirm or deny that you're on the correct path.
Yes, yes. So somebody with a fiery constitution usually has loose motions or diarrhea. They tend towards diarrhea or loose motion, or having to go to the washroom immediately after a meal, after a heavy meal. Whereas a person who is of the other type, where there is a lot of stasis in the body, is usually constipated.
Okay.
And the third constitution varies. There is nothing which is stable. So on one day there will be easy bowel movements. On the other day, the person may be constipated, or on the third day may have loose bowels. And so it's you kind of can if you start assessing the moment the person walks into your clinic, and if you start making observations, you are able to know a lot about the person based on these observations, and then trying to fit them in the framework that you are aware.
Well, and you can see how important those things are. I mean, as you discussed earlier, that people go to their GP. So you go into your GP and you're having constipation, they give you something for the constipation, but it doesn't really address the reason for the constipation. It just takes care of it. And so I want to make sure that people understand that even though you're going to, let's say the constipation is the issue, you're going to treat that, but you're going to treat it in a way that fits in with the holism of what the whole pattern is.
Yeah.
But this is the pinpoint that you have to get them to trust you.
Yes. So I'll give an example, and that will make it even easier, even clearer. Is if somebody, I don't remember if I've shared this with you the last time, but if somebody has a fever, the associated complaints are that of maybe a blocked nose, a heavy head, and loss of taste and loss of appetite and not wanting to eat. Now, if you think of the conventional treatment for a fever, it is just medication which will bring down the temperature, and nothing else is done to improve the others.
Yeah.
Whereas an Ayurveda physician will approach it in a way that, as you rightly said, will go to the root of the problem. And once you get there, the fever will come down. Along with it, the heaviness of the head and the blocked nose will clear, and the appetite will be restored. So we are not looking only at the body temperature as our goal. We are looking at restoring the health of the person. So when I say restoring the health, it is not only focusing on the temperature and then not worrying about, or just leaving the restoration of the other things, including the appetite, to chance. It's not that.
Oh. No, it certainly sounds very similar to approaches like Chinese medicine, where the root is the issue, and you, as they say, the root and the branch of being sick is the symptoms, and the root is what you have to treat. And obviously, you might see someone, it sounds like, and even though you've kind of gotten the correct framework, it takes a lot of time to individualize what you want to do. So when you see someone, I assume you have oftentimes a long-term relationship with someone. You're seeing them. It's not like an acute emergency. You made their symptom better, but then they have to really take the responsibility to want to do more. I mean, they could probably come see you for just the issue, but obviously the important aspect is letting them know that that's just the surface and you want to get down deeper to help them not get sick again.
Yes, that's absolutely true. And that's where it becomes, as you rightly said, it's a long-term association that you establish with your patients, who no longer may be patients, but they are still, they remain associated
Right.
for advice, or sometimes just use you as a sounding board uh, for issues that may come up. And that's another aspect that is often overlooked in medical practice, and that is to afford the luxury of time,
Hmm.
to be able to share that time with your patient. Because
Absolutely.
obviously, when you want to talk about all these things with them, it cannot be done quickly. You're not just looking at the temperature and saying it's so and so, it's 101, 102, whatever it is, and then that's it. This is the tablet, and you bring it down to normal, and that's it. You're out in 5 minutes. But when you have to start with assessing the constitution, you have to start with assessing the preferences, choices, uh, how the disease started, trying to get to what could be the possible causes for that particular disease condition, in trying to do it. So it's like a long interview. And in doing so, you kind of learn about a lot of other aspects of the person's life,
Yes.
which, however insignificant they may seem at that point in time, but they actually may be very, very important. So somebody who is going through a troubled personal life, for example, and presenting with uh, IBS. Now, if you overlook those problems, and if you don't take them into consideration, and no matter what you do to try and correct the IBS, it's not going away. So
Absolutely.
you
And
have,
I think that the trust builds up also by listening to someone's story. The fact that you're willing to give them the time to do that. I think that's one of the major complaints that we see in Western medicine now is, you're on a little timer and you don't have the time. So everybody just gets a medication because it's so much easier.
yeah, that's what it is. So that's if an Ayurveda practitioner is thinking about what is it that's needed to help him or her in building their practice, then this is an area that they have to seriously look into, is being open, being generous with their time.
Mm-hmm.
Because that's something which is a huge luxury in today's world, and to be able to be generous with it, and it goes a long way in helping your patients. It's sometimes, there are people I've come across who come to you with some vague symptoms, but all they actually want is to come and talk to you.
Mm-hmm. Yeah. They want reassurance that what's going on is it's
So,
okay. And we can work with this. The other thing is there's, going to physicians of any kind, there's all this fear that something bad is going to be found, or that, they're not going to be able to get better. And so it certainly sounds like when you're finished with your observations and your examination, you actually can provide an optimistic outlook for most people if they're willing to work with you and work for themselves in getting better.
yes. I mean, apart from a very few conditions which are terminal, which you can also uh, apprise the person. You can also let the person know that, look, this is what it is. But then the focus can shift to the quality of life.
That just went through my head also, is the quality of life, regardless of what you have wrong, becomes
Exactly.
essential.
Yes. So it's not just a length of life, isn't it? It's the quality also that matters. So in either situation, so where you know that okay, you will be able to help and get and make things better in those cases, as well as in other cases where that there's not much you can do in reversing the condition. But in that situation, you can always think of what can you do to improve the quality of life of that individual. So
Well, absolutely. I mean, even if the disease is very strong, if you can let them sleep better and you can make their mood better and just help them be able to enjoy the time they have, it becomes a real luxury for them.
yes, very much. So uh, that's what it is. So it's never being pessimistic about anything. It's not about lying through your teeth and saying that, oh, everything will be fine and I'll be able to cure everything. It's not that, but it's giving them an option of choosing to lead a better life.
Yes. Yes, I think that's probably one of the more important aspects that we offer in that regard. Well, this has been extremely enlightening, and I think we've covered a lot of topics. I'm going to have to see if I can keep coming up with ideas about what we can talk about, because it's so enjoyable to hear someone from a different culture and a different paradigm talk about the same commonality that we all have. We all want to get better. We all want to have a quality of life. It's just how we choose to approach it in terms of our care. So I want to thank you again for the time. And I know it's late for you and you probably have had a long day. So thank you very much.
Not at all. It's been an absolute pleasure connecting with you.
Thank you.
It just allows me to so it's like an exam that I take, and I mean this in a good sense, that it just helps me to almost present the information in a completely different perspective. So that's really helpful.
Well, and when we talk like this, it's very inspiring. You start putting down in words what you're really doing so that people can understand it. And it obviously carries across the culture that we both understand what each of us does, even though we're in our own little worlds.
Yes.
Thank you
Yeah.
very
So
much.
thank you for your time.
Thank you.